Before you watch this video, stop for a moment, look in a mirror, or think about the last time you clearly saw your own eyes. What color are they? Because what I am about to tell you is something that most people spend their entire lives never knowing, something that scientists have been quietly documenting for decades, something that connects the color of your iris, that ring of pigment you have looked at in the mirror every day of your life without a second thought, to your disease risk, your pain tolerance, your response to anesthesia, and your long-term vulnerability to specific medical conditions. Your eye color is not cosmetic, it is biological data, and once you understand what it is actually telling you about your body, you will never look at it the same way again. This is what your eye color is really saying about your health. Let us start with the most common eye color on Earth and the one that carries the most powerful biological protection: brown eyes. Over 70% of the human population has brown eyes, and that dominance is not accidental. It is the result of millions of years of evolutionary pressure selecting for a specific biological advantage. The color comes from melanin, a pigment so dense and so light absorbent that it functions as a built-in biological shield for the eye. Research from the University of Copenhagen confirmed that melanin in the iris absorbs up to 90% of incoming light, including harmful ultraviolet radiation, before it can penetrate deeper into the eye and damage the sensitive cellular structures behind the lens. For early humans living and working under intense equatorial sun, this was not a cosmetic preference, it was survival. Brown eyes perform differently from lighter eyes in ways that extend beyond UV protection. Because melanin absorbs rather than scatters light, brown-eyed individuals experience significantly less glare sensitivity in bright conditions. Visual performance in intense daylight is measurably better. The iris responds more efficiently to rapid changes in light intensity. But here is the health information that most people never hear. Research has found that brown-eyed individuals have lower rates of age-related macular degeneration, the leading cause of vision loss in adults over 60 in the United States. The melanin that provides UV protection in youth continues providing structural protection to the retina throughout life, reducing the cumulative damage that drives macular degeneration in lighter-eyed populations. The biological shield does not switch off with age. It works continuously for a lifetime. Now, the eye color that carries the most remarkable origin story in human genetics and one of the most significant health profiles of any eye color: blue eyes. Every single person on Earth with blue eyes shares a common ancestor, one individual, one genetic mutation, occurring between 6,000 and 10,000 years ago in the region around the Black Sea. Before that mutation in the HER2 gene, everyone on Earth had brown eyes. The mutation did not add a new pigment. It switched off the production of brown melanin in the iris, reducing it to near zero, and the blue color that results is not pigment at all, it is physics. Light entering a melanin-poor iris scatters shorter blue wavelengths, bounce back out, while longer wavelengths pass through, the same optical phenomenon that makes the sky appear blue. That single mutation spread through Northern Europe with a speed that baffled researchers. Within a few thousand years, blue eyes went from 0 to 70–95% frequency in some Northern European populations. But here is what matters medically. The near absence of melanin in the blue iris means significantly reduced protection against ultraviolet radiation throughout life. Research has consistently demonstrated that blue-eyed individuals face higher lifetime risk of uveal melanoma, a rare but serious cancer of the eye, compared to brown-eyed individuals. The risk differential is not trivial. Studies have found the risk in blue-eyed populations to be up to 6 times higher than in brown-eyed populations. Blue eyes are also associated with higher sensitivity to light, a condition called photophobia, which can be a symptom of underlying conditions including meningitis, migraine, and certain inflammatory conditions of the eye. Additionally, research published in pain science journals has found that women with blue eyes demonstrate higher pain tolerance during childbirth compared to brown-eyed women, and studies examining anesthesia response have found that blue-eyed patients may require different dosing considerations compared to dark-eyed patients. The color that entered the world as a single genetic mutation carries a specific medical profile that is only now being fully characterized, the rarest eye color carried by a significant population and one associated with a very specific evolutionary history: gray eyes. Found in fewer than 3% of people worldwide, gray eyes contain even less melanin than blue eyes. The light scattering that produces the gray appearance occurs across multiple wavelengths simultaneously, producing that distinctive steel or silver tone that shifts from pale to slate depending on light conditions. From a health perspective, gray eyes share many of the UV vulnerability characteristics of blue eyes. The reduced melanin provides reduced protection against ultraviolet damage over a lifetime. The risks associated with prolonged UV exposure to the eye, including cataracts and retinal damage, are elevated in gray-eyed individuals, compared to those with darker eyes. Functionally, the broad wavelength dispersion of gray eyes may provide enhanced light sensitivity in low-light environments, an adaptation that researchers believe evolved as a response to the low-light conditions of northern European winters, but that sensitivity comes at a cost in high UV environments. The health implication is practical and specific. Gray-eyed and blue-eyed individuals accumulate UV damage to the eye throughout life in a way that brown-eyed individuals do not. The protective measures that compensate for absent melanin, UV blocking lenses, sun protection, are not cosmetic considerations for lighter-eyed people. They are long-term medical ones, the rarest common eye color on Earth and perhaps the most genetically complex: green eyes. Only 2% of the global population has green eyes, and that rarity reflects genuine genetic complexity. Green eyes require at least 16 different genes working in precise coordination to produce their characteristic color. The combination requires moderate melanin levels, enough to produce color but not enough to shift. 2 brown plus a yellow pigment called lipochrome. The interaction of these two elements with incoming light produces the green hue. What makes green eyes medically interesting is their documented instability. Research has shown that green eyes are more sensitive to environmental changes than any other eye color, appearing mossy in shadow, golden green in bright light, and shifting toward hazel or blue-gray depending on surrounding colors and light conditions. This sensitivity reflects the moderate melanin levels that sit at the boundary between meaningful UV protection and meaningful light sensitivity. Green eyes offer more UV protection than blue or gray eyes, but significantly less than brown or dark eyes. From an evolutionary standpoint, green eyes appear to have developed in temperate climates with variable lighting. Populations of Celtic and Germanic ancestry show the highest concentrations, up to 86% in some Irish and Scottish populations. The health profile of green-eyed individuals sits between that of blue-eyed and brown-eyed populations, with intermediate UV risk and intermediate light sensitivity, reflecting the moderate melanin levels that produce their characteristic color, the eye color that is the most visually dynamic and the one that has generated the most research interest in recent years: hazel eyes. Approximately 5% of the global population has hazel eyes, and unlike any other eye color, hazel eyes genuinely change appearance based on lighting, clothing color, and surrounding environment. This is not an optical illusion. It is a physical phenomenon driven by intermediate melanin levels and traces of lipochrome that interact differently with varying light conditions. The health research on hazel eyes is particularly interesting because their intermediate melanin levels place them in a complex position with respect to UV protection and light sensitivity. Some research suggests that hazel-eyed individuals may experience a higher rate of certain light sensitivity conditions compared to darker-eyed individuals, while facing lower UV risk than blue or gray-eyed populations. The variability within the hazel category is also medically significant. 2 people classified as having hazel eyes may have dramatically different melanin distributions, one with more green and less brown, another with more brown and less green, producing genuinely different health risk profiles despite sharing the same general color category. The eye color that is most commonly misclassified and most consistently underestimated: amber eyes. Found in fewer than 5% of people, amber eyes contain high levels of lipochrome with very little melanin, producing a solid golden, copper, or honey-colored iris that does not shift with changing light conditions. Unlike hazel, which changes, amber stays richly golden under all conditions. The health profile of amber eyes resembles that of other low-melanin eye colors, with elevated UV sensitivity and higher lifetime risk of UV-related eye conditions compared to darker-eyed populations. The stable, non-shifting quality of amber eyes, unlike the dynamic hazel, reflects their very specific and consistent pigment composition. Amber eyes are most commonly found in individuals of Southern European, Asian, and South American ancestry, representing a different evolutionary pathway to reduced melanin than the Northern European pathway that produced blue and gray eyes. The eye color that does not exist but that most people believe they have seen: true black eyes. What appears as black is an extreme concentration of dark brown melanin so dense that the iris appears completely black in most lighting conditions. This level of melanin saturation represents the far end of the spectrum that begins with amber and moves through brown. From a health perspective, very dark eyes carry the strongest UV protection of any eye color. The near-total light absorption of the densely melanated iris provides maximum shielding of the deeper structures of the eye. Research confirms that individuals with very dark eyes have measurably lower lifetime rates of UV-related eye conditions compared to all lighter eye colors. The same melanin concentration that provides this protection also affects how the eyes communicate in social contexts. Dense melanin makes pupil dilation, which occurs in response to emotional states including attraction, fear, and interest, significantly harder to detect from the outside. The social and clinical implications of this are still being studied. The condition that affects fewer than 1% of the population and that can carry medical significance beyond its visual appearance. Heterochromia, the condition where a person has two differently colored eyes or significant color variation within a single iris. In most cases, heterochromia is a benign result of minor genetic variation in melanin distribution during early eye development, but acquired heterochromia, a change in eye color that occurs after birth. In an eye that was previously a consistent color is a different matter entirely. Acquired heterochromia can be produced by several medical conditions, including Horner's syndrome, a neurological condition involving the sympathetic nerve pathway to the eye, Fuchs' heterochromic iridocyclitis, an inflammatory condition of the eye, glaucoma, and certain medications including prostaglandin analogs used to treat glaucoma that can permanently darken the iris. A change in eye color in an adult in one eye or in a portion of one eye is not a curiosity. It is a clinical finding that warrants ophthalmological evaluation. What your eye color ultimately represents is not a cosmetic preference selected by the universe at random. It is the result of specific genetic combinations, some ancient, some recent, that determine the amount and type of pigment in your iris. That pigment level determines how much UV radiation reaches the deeper structures of your eye over a lifetime. It influences your sensitivity to light and pain. It affects your risk profile for specific conditions, from macular degeneration to uveal melanoma, in ways that are measurable and documented. Brown eyes, maximum UV protection, lowest UV-related disease risk, optimal performance in bright light conditions. Blue and gray eyes, minimum UV protection, elevated lifetime risk of UV-related conditions, highest light sensitivity. Green, hazel, and amber eyes, intermediate positions on the melanin spectrum with intermediate risk and sensitivity profiles. Very dark eyes, the strongest biological protection available in the human eye. This is not folklore. It is genetics. It is physiology. It is decades of documented medical research connecting the color you see in the mirror to the specific biological characteristics of the eye behind it. The color of your eyes has been with you since before you were born. Now you know what it has been telling you. If this information changed the way you see something you have looked at every day of your life, share it with someone who needs to hear it. Subscribe for more evidence-based health information, clearly and completely explained. Stay informed, stay aware. We will see you in the next one.